Have you heard of Alzheimer's disease before?
Of course.
Yes.
I have.
Yes.
Kind of.
Yes.
Yes.
Yes, I have.
Yes.
I have.
Yeah.
Yes.
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 Yes, I have.
Yes, I've heard of Alzheimer's before.
Can you explain it to me?
You slowly start losing your memory.
It's when you forget things that happen in your life.
When you start losing your memory, it's usually in older people.
Something with your memory loss.
Your memory is affected. Memory starts to go.
I think it's when people start forgetting.
It's when you start to lose your memory. It is a progressive neurological disorder.
It's a neurodegenerative disease that reduces the memory of people in old age.
Your brain deteriorates.
It's a progressive disorder affecting the brain and affecting memory.
It's a form of dementia. It's the most common form.
Increases in incidence as individuals with dementia get older.
It's not a normal part of aging.
It's a disease that primarily affects older people, and it impairs people's short-term memory.
It's when you have difficulty remembering certain things.
Have you been affected by it?
My mother-in-law.
My grandmother has it.
I know friends that have been affected by it, their grandparents.
I think my grandpa had Alzheimer's.
Friends and family, like their parents. There's somebody at my church.
My mother.
I have an aunt that has dementia, which I guess it falls under the same category.
My grandmother.
My grandfather.
My grandfather and grandmother had it.
Now that we know all you know about Alzheimer's disease, this is Alz We Know.
Alzheimer's is a fatal disease that slowly destroys the brain. It currently affects 1 in 10 people over the age of 65. There is no set cause of Alzheimer's, however there are risk factors which we will discuss later in the video. Patients with Alzheimer's have abnormal protein deposits in their brain. These proteins are called amyloid and tau. They are present in healthy brains, however in an Alzheimer's patient they function abnormally. They eventually form abnormal fragments called plaques and tangles. The plaques and tangles attack and damage nerve cells across the brain, causing cells to die. Alzheimer's destroys the ability to create short and long-term memories, communicate, problem solve, grasp concepts, control mood and emotion, understand sensory information, maintain balance and coordination, and worst of all, the ability to control the heart and breathing. Alzheimer's is a slow and relentless disease that at this time is incurable.
You can imagine how losing your memory can cause some frustrations. Losing memory could also leave someone with confusion about who they are. Some side effects you might want to look out for if someone you know has Alzheimer's disease is changes in their personality. You might notice passive behaviors like inappropriateness, lack of emotional response, or fearfulness. Also, they might be highly irritable and self-centered. These behaviors will increasingly worsen as the disease progresses. It is important to remember that these behaviors are caused by the disease and not take them to heart if they negatively affect you.
No cure has been found for Alzheimer's yet, and although current Alzheimer's treatment cannot stop the disease from progressing, they can temporarily slow the worsening of dementia symptoms and improve quality of life for those with Alzheimer's and their relatives. One research conducted by Sano et al. In 1997 used 2 agents, selagelene and vitamin E, to treat 341 patients with a clinical dementia rating of 2. They then measured the time to occurrence of the following 4 factors: loss of the ability to perform basic activities of daily living, time in a care facility, severe dementia, and death. Results showed that there was a delay in loss of the ability to perform basic activities of daily living and an increase in median survival for those patients who were treated with the 2 agents. For facility time, the comparison of vitamin E with placebo showed a significant treatment effect. Finally, the patients receiving combined therapy showed a decrease in behavioral symptoms of dementia, while those receiving placebo had an increase in symptoms as time progressed.
Now that we know what Alzheimer's disease is, let's talk about what people can do to either prevent it or make their lives better. To begin with, physical activity is key. Studies have shown that just doing exercise, for example a brisk walk/run, leads to a reduced risk of Alzheimer's disease. It also increases the lifespan of Alzheimer's patients. Another factor that has a positive impact on this disease is music. A study on the effects of music on Alzheimer's patients indicated that listening to music can help enhance their cognitive ability. According to Dr. Finnerty, a professor at McMaster University, music can be used by family members to help their loved ones with the disease. The only concern is that family members lack the ability to understand what the person is going through. This issue can be addressed through the Music Therapy Academy at McMaster University that educates members about music and how it deals with Alzheimer's.
And that's all we know. Thanks for watching.